Differential case presentation by Sosa. This week's assignment was to choose a case study that was presented from week 7 to display different differential diagnosis according to symptoms that a patient is presenting. So that is what I'll be presenting now in this PowerPoint presentation. The patient that I chose was patient 1, which is a 28-year-old woman. For the sake of this case study, I'll call her Jane, with opioid use disorder, uses IV heroin. She has PTSD, no other medical problems or medications. She's currently single and lives with several roommates and has a history of legal problems with some jail time. She's sexually active with both men and women, is inconsistent and has inconsistent use of protection. And so along with these statements of history that Jane has, she's also complaining of chest pain, flank pain, and fever. And so as an APRN, I'm going to go ahead and discuss and give points as to what I believe she is presenting to the clinic with. Demographics. She is a female. We know that she's 28 years old. We know that her marital status is single and that she's had a history of jail time. These 4 things I believe are significant in noting because as I go through the presentation, I will notate these specific demographics that relate to her symptoms and diagnosis. So why are these complaints? As I mentioned before, she is also presenting, along with her history, symptoms of shortness of breath, chest pain, flank pain, and fever. Before, as we saw in the patient's history, she had a history of opioid use disorder. She uses IV heroin, and she has PTSD. So what does that have to do with these complaints that the patient is having? According to the National Institute of Drug Abusers, with heroin, the rush is usually accompanied by a warm flush of the skin, dry mouth, and a heavy feeling in the extremities. Not only that, nausea, vomiting, and severe itching may also occur. After these initial effects, users usually will be drowsy for several hours. Their mental function will be clouded, and their heart function slows, and breathing is also severely slowed, sometimes enough to be life-threatening. And they also mention that withdrawals include lower back pain, withdrawals of opioids, past opioid abusers. And so that would attribute to the shortness of breath, the pain that she's feeling, and the fever. So what could these be a sign of? Next in this presentation, I'll go into the 3 differential diagnoses that I believe the patient may have given her presenting symptoms. Differential diagnosis number 1, hepatitis C. Hepatitis C, or HCV, is most common bloodborne infection in the U.S., with an estimated 2.7 to 3.9 million people having chronic HCV infection. HCV is a viral infection that causes liver inflammation, leading to severe liver damage if untreated. Hepatitis C is caused by the hepatitis C virus. The infection spreads when blood contaminated with virus enters the bloodstream of an uninfected person. So again, we have to bring back and remember the history of this patient, that she uses IV heroin and past history of opioid use disorder. And so according to the Mayo Clinic, those who are susceptible to hepatitis C are those who have ever injected or inhaled illicit drugs, or those who were ever in prison. And we know that this patient also had a history, based on her demographic that we talked about earlier, also had a history of jail time. The second differential diagnosis that I believe this patient could have, given on her presenting symptoms, is HIV. Women appear to be at increased risk due to a shorter time span between drug use initiation and initiation injection, suggesting a faster trajectory to injection drug use from IV heroin compared to men. Women also self-report more injection-related injuries and diseases, including higher rates of increased mental health issues, which we'll touch on later, and sexually transmitted disease. Research indicates that some lesbian or women who have sex with women engage in high-risk behavior that place them at a risk for HIV transmission. This was included in this case study because we also know, given her history, that she has unprotected sex with both men and women. So some women who have sex with other women use injection drugs and may share needles and works. These are some of the risky behaviors that the GMHC indicate women who have sex with women engage in. Also, these specific group of people, when they have sex, they could have multiple sex partners or sexual histories, and even having sex with HIV positive men and or injecting drug users. According to the CDC, lesbians long ignored HIV prevention and service programs because the CDC had no confirmed cases of HIV that was transferred from female to female. HIV.gov also notes that signs and symptoms of HIV are fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, and mouth ulcers, some of these symptoms which Jane is actually presenting in the clinic. Fever, muscle aches, complaint of pain. So we can see that according to some of these shared symptoms that she could possibly have HIV. And finally, the third possible differential diagnosis that Miss Jane may have is bipolar depression. We know that she has a history of opioid use disorder as well as PTSD. Researchers of a new study examining the relationship between mental health disorders and prescription opioid use found that more than half of opioid prescriptions are prescribed to patients with depression and other mental health disorders. People with mental health disorders, depression, anxiety, or mood disorders are being prescribed more than 50% of the country's opioids alone. And so this all can tie in with hepatitis as well. And according to authors Schoffer and Sakar, 2013, behavioral health factors have a significant role in the treatment process of diagnoses like HIV and hepatitis C. And those who have these conditions are at a higher rate of substance use disorders, as well as elevated rates in depression, bipolar disorders, anxiety, and psychotic disorders. Summary. So most likely the culprit of this patient's Jane complaints, I believe, is hepatitis C. I believe that overall, among the three diagnoses, that hepatitis C is the one that, if given diagnostic tests to this patient, would come back in the results. Given that all the symptoms and the presented differential diagnosis that I presented all intertwine, and the symptoms all seem to be deriving from similar symptoms as hepatitis C. As I mentioned before, behavioral health factors have a significant role in the HCV treatment process that attributes behavioral health has a link to HCV. All the more, individuals with HCV have high rates of substance use disorders, 60 to 90%, as well as elevated rates of depression, bipolar disorders, anxiety, and psychotic disorders, as mentioned before. We also noted earlier that women report more injected-related injuries and disease, including higher rates of thrombosis, septicemia, mental health, and sexually transmitted disease, i.e. hepatitis C, which can be given from needle, and sexual transmission. And diagnostic. How is hepatitis C diagnosed? Doctors usually use blood test called a hepatitis C antibody test to find out if a person has ever been infected with hepatitis C. The hepatitis C antibody test, sometimes called the anti-HCV test, looks for antibodies to the hepatitis C virus. Antibodies are chemicals released into the bloodstream when someone gets infected. If the antibody test is reactive, an additional blood test is needed to determine if a person is currently infected with hepatitis C. This test is called an RNA test. Another name used for this test is PCR test. If the RNA test is negative, this means a person does not have hepatitis C. If the RNA test is positive, this means a person currently has hepatitis C and should talk to a doctor experienced in diagnosing and treating the disease. Also, I believe I forgot to mention here that when testing for hepatitis C antibody test, the results can either come back as non-reactive or negative hepatitis C antibody. Treatment plan. How is hepatitis C treated? Doctors recommend that patients with hepatitis C get bed rest, drink lots of fluid, eat a healthy diet, avoid alcohol, and take antiviral medications. The patient also needs to make sure that they see their doctor regularly for follow-up blood tests to make sure that the body has fully recovered from the virus. So as an APRN, would I refer this client out to someone else or to get different resources? The answer is yes, most definitely. I would refer this patient to a number of different resources. I would refer her to a hepatologist who focuses on diagnosing and treating diseases that affect the liver. I would also refer her to a gastroenterologist who focuses on diagnosing and treating diseases that affect the digestive system, including liver once again, an infection disease specialist who have expertise on managing viral infections such as hepatitis C, and other nurse practitioners, apart from myself, who may focus on treating people with liver conditions. Here are a list of my references that I used throughout this presentation. And thank you all so much for tuning in to this presentation.